Surveying. Whenever possible, casts should be surveyed with the occlusal plane parallel to the base of the surveyor, so that path of placement is perpendicular to the occlusal plane. The position usually demonstrates favorable tooth contours which permit the development of an acceptable design. This neutral or 0-degree tilt facilitates development of a path of placement which may be easily managed by the patient. Let's have a look at this patient wearing the lower complete denture and maxillary metal partial denture. Denture out and then put it back again.
Okay. The top one or the bottom? Both one. Okay. The bottom one easy. And the top one is easy.
Okay.
Okay. Now.
And then where is that?
Okay. Okay. And here's the challenge.
Other way.
Other way.
As you notice, the maxillary partial denture does have a metal framework. When the patient has a partially edentulous condition, we plan to design metal framework which provide the support, stability, and the function of removable partial denture. And this is when the metal framework placed in intraorally. And the surveying is the tool, the analysis, before we fabricate the metal framework. So, surveying on analysis and comparison of the prominence of intraoral contours associated with the fabrication of a prosthesis. This is the components of dental surveyor. Here you're looking at the base, and this is the vertical arm, and this is the horizontal arm. And this vertical portion is called the mandrel, and the last thing is the surveyor table, which holding the cast to analyze. And plus in accessory, there's an analyzing rod, and these two are the wax carver, and this one showing carbon marker holder. And there have 3 undercut gauge starting from the 0.01 inch, 0.02 inch, 0.03 inch undercut. So these are the components. This surveyor table has open close lock latch to allow you to have a ball attachment roll around it so that you could place the cast in many different positions. The analyzing rod is the metal rod placed against the teeth or the ridges during the initial analysis of the cast to identify the undercut area and to determine the parallelism of surface without marking the cast. So here you're looking at the distal portion of the tooth, which one of the abutment, and you can see there's an undercut amount below the analyzing rod. And you need to make these area to be equally distributed between the anterior and posterior abutment present. Carbon marker and holder is the graphite marker is moving around the tooth along the alveolar ridge to identify and mark the position of maximum convexity we call survey line. And when surveying a tooth, the tip of the marker should be level with the gingival margin, allowing the side of the marker to produce the survey line as shown in this picture. The undercut gauge, which we mentioned about the 3 different kind, and gauge are provided to measure the extent of horizontal undercut, which is showing on this picture. So amount of this undercut, while the body of the gauge are touch the top portion of the tooth, at the bottom, this horizontal ring, when it's touched, it will show you what will be the how much of the undercut, the tooth present below the height of the contour or the survey line. By adjusting the vertical position of the gauge until the shank and the head contact the cast simultaneously, the point at which a specific extent of horizontal undercut occur can be identified and marked. And this precise location will be the future position of the retentive arm of our clasp. The purpose of surveying is determining guiding plane and finding out the tooth undercut by locating undercut area that related to the retention of your prosthesis, and identify the height of contour, and also evaluate interference. And it also evaluate the aesthetic to determine the most suitable path of placement for aesthetic. And the last one is finding the path of insertion. Determine the most acceptable path of placement and removal. Whenever possible, the cast should be surveyed with its occlusal plane parallel to the base of the surveyor. So this is the sequence when you're doing the surveying. We need to identify the anterior posterior tilt first. Then we check the lateral tilt by looking at amount of the undercut present on the buccal surface of the abutment. And the last will be tripartization. So let's take a look at the anterior posterior tilt. When the metal framework seated or remover, it follows through the path of insertion that we determine. And watch carefully about the amount of undercut, because this portion should be relieved so that the metal framework could be inserted without the trouble. When you tilt the cast, the amount of the undercut will change because of the path of insertion change. And when you tilt opposite way, that undercut amount present on the distal of the abutment are affected. So when you're making anterior posterior tilt, generally saying, in most of the case, the cast should be surveyed with its occlusal plane parallel to the base of the surveyor, meaning this occlusal plane of the cast to make it parallel to the base of the surveyor, and that will provide you most suitable position for the placement of prosthesis. This is a closer view when you're looking at the analyzing rod, looking at the anterior portion, and by tilting, by making the occlusal plane parallel to the base, this amount from here to here has more favorable condition, and that will be the anterior posterior tilt. And this area that we just looked at in the proximal surface will be the location of our guide plane, which is a component of metal framework, will be placed and positioned. And two or more parallel axis surface to limit the path of insertion and improve the stability of removable prosthesis. Meaning, when you make this guide plane as a parallel each other between the two surfaces of abutment, this will make this removable prosthesis better stability. Compared to has diverged contour surface, it allows multiple paths of insertion, meaning the multiple paths of displacement, which makes the prosthesis less stable than when you have one path of insertion. So again, anterior posterior tilt generally whenever possible, make it occlusal plane parallel to base of surveyor. Once you complete anterior posterior tilt, the next step is making lateral tilt. This lateral view in lateral tilt, meaning that when you're looking at the cast in the frontal view and try to look at the abutment of the buccal surface and make it even undercut amount, so the equalized retention on both sides. When you tilt this cast on one side, then tilted side will increase the amount of the retention. On the other hand, the other side of the abutment will decrease the undercut amount. So this is not what you want to have it. Instead, you want to have equalized undercut amount on both sides so that retention amount will be equally distributed. So this is a closer view, how much undercut you have, and when it's tilted severely or tilted toward to that area, you notice the increased amount of the undercut present on the buccal surface. This is a determinant of the how much retention that you will have with the metal framework. So in digital analysis, this color is the amount of the undercut that is present. Yellow color is showing 0.01 undercut gauge, or orange color is showing a 0.02 inch undercut, and the red color meaning 0.03 inch undercut. So again, when you setting the lateral tilt, you want to equalize right and left side of the undercut amount evenly distributed so that retentive arm will engage onto these determined undercut area. So the tip of the retentive arm will be engaged onto this color, which is undercut zone. This is another mandibular cast, determining the lateral tilt. And again, the same thing, you wanted to look at the equalized undercut amount on the right and left side of the last abutment tooth. So when you look at this color, you can notice the equal amount of the undercut present on the last abutment teeth. Then using the carbon marker, mark the height of the contour, which is called survey line, on abutment teeth, the tooth that will have a clasp component. After you complete the lateral tilt and finishing the survey line, then the last thing is tripartization. And this is how you mark tripartization on your cast. So that's the completion of surveying, analyzing the cast for the metal partial denture.